And now that we're just about ready, Ike Alma would like to say a few words regarding University House Wallingford and our speaker today.
Hello, I'm Ike. As many of you know, University House Wallingford has a unique partnership with the University of Washington Retirement Association, the UWRA. This relationship gives our community a distinct academic flavor where residents enjoy connection to UW programs and a commitment to lifelong learning. As a narrow living community, our residents benefit from the partnerships developed with the University of Washington Schools of Nursing, Social Work, and Pharmacy to deliver innovative programs designed with healthy living in mind. We are honored today to have with us Dr. Barbara Cochrane, who has joined us today to present on a wonderful topic, living wisely and physical change. Dr. Cochrane is a Tornyay Endowed Professor for Healthy Aging at the UW School of Nursing, where she has led nursing and interdisciplinary initiatives for healthy aging and elder-friendly futures for the past 15 years. She is also a joint associate member of Fred Hutchinson Cancer Research Center. Thank you for joining us today, Dr. Cochrane.
So I can start my screen?
Yeah.
Absolutely.
Hi, everyone. I hope you can see my slides okay and me in a little bit of a screen. Thank you for inviting me to do this talk. This is kind of a brave new world for all of us, and I hope you're staying safe and healthy. The title of this talk is Living Wisely with Physical Change, Aging from the Inside Out. And that title actually comes from Reba de Tornyay, who used to do a guest lecture in my Biology of Aging course at the very end. And her talk was Aging from the Inside Out, where she would present to students the actual experience of the biology of aging that kind of brought everything together. So I thought it was a fitting tribute to Dr. de Tornyay to describe this as aging from the inside out. What we're going to cover today are some physical changes inside and out, focused on what's normal. But I'll also talk about some common age-related health changes and aspects of living wisely and health promotion. However, if you see this little dog here with the hairpiece on, that just is to remind me to say it's pretty impossible to cover everything. So we'll just take a little bit of a hairpiece look at physical changes throughout our bodies as we get older. What is normal aging? Normal changes of aging are actually different from age-related disease. Age-related disease are those kinds of changes that we see more often in older adults, usually as a result of a lifetime of habits and exposures and things like that. But normal changes of aging begin with conception, they continue throughout our lives, and they're really viewed as completely universal in all people, progressive, inevitable, and many would say deleterious. But I have been challenged, and I challenge you to really think about the physical changes of aging as opportunities and possibilities for enhancing our lives and the lives of people around us. Older adults are highly diverse individuals, so we don't all change in the same way. And healthy aging can start at the beginning of life, because if you think about it, older adults are the survivors. So I hope some of this information will help you feel empowered, as well as thinking wisely about the changes that you've been going through and how to manage them, but also celebrate that you're a survivor. Health at older ages varies quite a bit. Poor health is not inevitable. So I'm going to be starting by going through the various body systems. I hope this doesn't get too sort of didactic. I'll try to make it a bit fun. I also hope it's not too overwhelming or too insulting in terms of the level. But just to start talking about the cardiovascular system, the heart and the blood vessels, some of the changes that occur are that the blood flow around the heart through the coronary arteries decreases as we get older. There are changes in the pacemaker cells and the electrical conduction in the heart that keeps our hearts beating in a uniform, coordinated way. The heart also has slightly less effective pumping because the muscle thickens and the heart valves and the arteries stiffen. These are all normal changes of aging. They have only a minimal impact on our heart function when we're at rest and sort of normal activity. But our systems, our heart in particular, if it's challenged, if it's stressed, if it's overworking, these are the kind of changes that can signal to us, oh, I'm getting a little more tired than I used to, or I need to take care of myself. As far as blood vessels go, you might have heard the term atherosclerosis before. Those are the plaques that develop with progressive hardening of the arteries. That's actually not a normal change of aging, even though we see it in almost everyone. Atherosclerosis is an abnormal or age-related change. We also see in the blood vessels decreased elasticity. They're stiffer, and that's why we see often a slight increased blood pressure. Age-related health conditions of the blood vessels, though, are not normal. And so there are more older adults who have hypertension than younger adults, and older adults experience something known as orthostatic or postural hypotension. This refers to the fact that sometimes when we stand up, and I hope you're okay, I'm saying we because I am now an older adult on Medicare and celebrating my wisdom and my empowerment with age. But when we stand up, our bodies need to adjust. That's just a little bit of a stress. And so standing up sometimes can cause the blood to sort of be pooling down and takes a little bit of time. And so you may notice if you stand up too suddenly that you get a little bit dizzy. This can be caused by blood return from the lower legs. It needs to work harder to get all the way up to our brains. In terms of our lungs, we want to be able to take a deep breath, and actually lung capacity declines, but it doesn't seem to have a huge impact on our function when we're sort of at normal activity. Our lungs are slightly less elastic. They're stiffer. The air spaces enlarge, and so what we have is known as air trapping. That means that there's more air sort of stuck down in the lower parts of the lungs that aren't getting up to get exchanged with oxygen and fresh air. And this is known as air trapping or increased reserve or increased reserve capacity that is not getting the good oxygen down to the tissues. Other changes that we see in the airways and the lungs is that there's decreased airway clearance. In other words, people have decreased sensitivity to things that we should be using to limit the opportunity for things like viruses and pollen and that sort of thing to get down into our lungs, but our cough reflexes are not working as effectively as they did when we were younger. And the hairs that are in our airway that are supposed to be beating and getting things back up so that they don't go into our bodies are decreased, and so they're less effective. So there's decreased airway clearance of the sort of things that we don't want coming into our body. And that means that there's decreased oxygen circulating to meet the changing needs as we go about our world. and our activities of the day. Some age-related changes that we see in our lungs that are not normal include emphysema and bronchitis, but you can see how, for example, smoking, when one has less of the hair cells that beat the bad things back out, or we have decreased cough reflex, that means that some of that mucus and those kinds of things can settle down and get trapped in our lungs, and then that decreases the exchange of oxygen and we feel more winded. It also means an increased risk of infection for older adults. And so thinking about infection, we're hearing an awful lot about coronavirus right now. The immune system in older adults, its efficiency does decline, but it declines to varying degrees. So we have less effective defenses like cough reflexes and that, but also a decreased ability to make antibodies and combat the kinds of specific bugs and viruses that we might get exposed to. This means there are some common age-related changes that are not normal, but we see them more in older adults, such as more autoimmune disorders. In other words, our bodies are developing defenses against things that should be safe. And so we see more conditions like cancer, like lupus, those sorts of things. Common infections can be experienced more severely in older adults, and it's why you are asked to have a flu shot each year and are put in a high priority category. And there's a slower recovery and a decreased chance of developing adequate immunity when you're exposed to things. So for older adults, vaccines are really important even when there's not a pandemic. I just want to let you know that I'm not able to see the chat, so I'll have to rely on you, but if there are any questions, please feel free to let me know or put it into the chat.
No questions yet.
Okay, and I'll talk a little bit about the neurological changes, but a lot of these changes are also more cognitive. And so I'll leave that for, I think, some other speakers that you have had. Just know that as we get older, our brains decrease in size and weight. The ventricles in the brain, which are the spaces, those increase. There are decreased numbers of neurons and neurotransmitter levels. So you can get a sense with those kinds of decreases, things are not working as efficiently, as effectively, a little bit more slowly. There's also increased deposits and neurofibrillary tangles within the brain. And those are some of the signs that we see if they get profound in people who have dementia type conditions. For older adults, there are certain aspects of our cognitive abilities or intelligence that are pretty resistant to aging. This is known as crystallized intelligence. So things like history that we've known all of our lives, things that we're very practiced at, the meaning of words, those kinds of things don't change a lot as we get older. But what does change is something known as fluid intelligence, and that refers to the kinds of things like learning new skills. I don't know how it has been for any of you, but my 90-year-old mother is still struggling a bit to manage her computer and her iPad. In fact, she's Zooming right now with her church, and I'm keeping my fingers crossed that it went okay. But those kinds of things of learning new information, fluid intelligence, are a little bit more difficult. Another aspect of fluid intelligence that we sometimes see is increased difficulty coming up with the words that we want to say and we want to use. Sometimes this is known as expressive aphasia, but it just is sometimes, like trying to go through the web of our minds to pull out the right word that we're thinking of. I have to admit that that happens to me quite a bit, and I'm very thankful that there's now a web where I can sort of, search to get that word that I'm looking for. Early diagnosis for some of the conditions, the age-related conditions that we see, is really helpful, even if there is no cure. I often get asked this question: why would I want to know early on if I have Alzheimer's disease if there's no cure? But early diagnosis is helpful because an individual, their family, can prepare for what's to come and make sure that the plans that are being made really represent what the individual wants, while things are still working effectively. Parkinson's disease is another age-related neurological change that does not necessarily happen for all older adults. And stroke, which refers to either decreased oxygen or blood clots in the brain, is another neurological change that can be seen and can be prevented, particularly if the individual and their family members are really tuned in to changes like facial drooping, weakness of the arms, that sort of thing. Sensory changes is a huge physical change, I think, that most of us recognize. I actually have been amazed. My 43-year-old son is now experiencing the vision changes that we see with aging. What happens is that the lens of the eye starts thickening, and if it thickens a lot, which is not normal, a normal change, that's known as a cataract. There's also decreased contrast sensitivity, in other words, distinguishing between colors, and a delayed recovery when a person goes from the glare into a dark room, that sort of thing. And that's known as presbyopia. They're normal those are normal changes of aging, but if it gets really profound, such as with cataracts, with macular degeneration, which involves the central vision, those are the more age-related changes that we see more often in older adults, but you're not necessarily going to experience it. Hearing changes are experienced by everyone. There's a gradual loss of hair cells in the ears, and it's that beating of the hair cells that gives us cues about what's being said. And so one of the things that happens for people as they experience these changes are that high frequency sounds are a little bit more difficult to hear than lower sounds. In fact, when I used to train interviewers on research studies, they were often young women, slightly older girls, and I had to continually remind them that if they were working with someone who was hard of hearing, to please don't talk louder, because a woman who talks louder, their voice gets even higher pitched. Instead, talk lower so that they can be heard. There's also, with this presbycusis, which is the hearing changes of aging, some difficulty with speech discrimination. But it is not normal. It is an age-related change, and there's usually multiple factors involved for someone who has hearing loss to the extent that they might need some kind of amplification or hearing aid. Another thing we're actually hearing a lot about right now is changes in sense of smell. You've probably heard that individuals who have developed coronavirus, sometimes one of the early cues is that they have a decreased sense of smell. We do see some decrease in olfactory receptors, or the receptors in the nose, in older adults in general, but it's usually not enough to profoundly impact smell perception. And we see some changes in taste as older adults move along, but those changes are often due to the fact that our sense of smell and our sense of taste are very tightly linked. So it's not as much a change in the taste buds of our tongues, but instead it's the fact that our smell is changing, and so it's changing how we perceive the taste of things. And then just to mention another sensory change is touch and balance. So it might be sometimes a little more difficult to discriminate between different types of touch. Our reaction time might be a little bit slower when we're pulling away from a painful stimuli, or if we are trying to react to being a little bit unsteady on our feet, sometimes that reaction time is slowed, and then, as I'll talk a little bit about later on, it can increase our risk of falls.
Dr. Cochrane, we do have a question in the chat.
Okay.
We have somebody who would like you to explain low-grade inflammation and how serious it is.
Low-grade inflammation. Well, it's hard to say in terms of inflammation where, but inflammation usually refers to some kind of irritant or infectious process in which the cells of the body are reacting and trying to combat it. And so you might see low-grade inflammation because there's kind of a general alert that the body does when it's exposed to foreign kinds of substances. Not sure if that's what you mean, but I am not aware of a sort of a low-grade inflammation condition beyond the fact that some of the changes of aging are viewed as inflammatory in origin, in part because of the physiological or functional changes that are going on inside our body with both our immune system, our hormones, our cardiovascular systems, those sorts of things. I hope that answers the question a bit.
Thank you, Dr. Cochrane.
So in terms of gastrointestinal changes, I sort of started with the mouth and we're going to work down. We see much more dryness in the mouth as we get older, and that's because there are some changes in glandular secretions. We're also taking, as we get older, a lot of medications which have side effects. So those are not normal changes if you're having dryness because of a medication. We do experience some recession of our gums known as gingivitis, but that also is not usually or normally profound enough to cause tooth loss, the need for dentures, that sort of thing. It's just a reminder to, continue to take care of your teeth and brush them well. The nice thing is that it is becoming the norm that healthcare professionals, dentists, and older adults are not expecting that they're going to have dentures. Instead, they're really trying to preserve their teeth and recognize some of the early signs, such as gingivitis and plaque formation, that can end up with tooth loss, which is not a normal change of aging. Another thing that we see is in the esophagus, which is that tube that goes from your mouth down to your stomach. And there is some decline in sphincter function, the muscle that sort of keeps food down. There also is some stiffening of the wall. So people experience a bit more heartburn, and many older adults experience GERD, or gastroesophageal reflux disease. That is not a normal change of aging, but it's certainly, with these other kinds of changes like a decline in sphincter function and stiffening, can get worse if there's other things also going on. In the stomach, there's decreased motility or movement or contractility. And so there's sometimes decreased emptying. So you may feel full sooner and experiencing some sense of bloating a bit. And there's a decreased cellular protection of the gastric mucosa, which means that you might have more problems with gastric ulcers and that sort of thing. But again, going to that extreme is not the normal change of aging, but these sorts of changes, like the decreased motility, the decreased cellular protection, can set a person up for having more problems if there's other things also going on. With the intestines, it's interesting. There's actually not as much change as you might think. There is some decreased motility. There is some change a little bit in absorption. But some of the things that we experience as older adults in constipation, bowel incontinence, that sort of thing, it is not a normal change of aging, but it may be a change that is prompted by other things going on, lifestyle, habits, heredity, that kind of thing. So then as we go to the bladder and such, just want to mention, so this is a picture of the bladder. These two tubes here are ureters, and the kidney comes up here and empties into the bladder. So the bladder has more commonly some involuntary contractions. It more commonly has incomplete emptying, and people do experience changes in the bladder, some retention, some incontinence, but again, to go to that extreme is not a normal change of aging, but the changes that we experience certainly set us up for that. The urethra, which is this tube that goes from the bladder out to the outside of the body, gets a little bit thinner, it gets weakened. And for you men, if you've got prostate enlargement, that means that you potentially are going to have some urinary retention or some difficulty voiding, because the prostate is kind of squeezing around that weakened, slightly thinner urethra. I hope that makes sense. So again, it's not a normal change, but the changes that we're experiencing set us up if there's other things going on. The kidney, which is up here, as I said, there is some atrophy or decrease in the size, some sort of compromise of the vessels. And what that means is that there's sort of decreased blood flow or renal perfusion, and then decreased filtration, which is the process by which the blood goes through the nephrons of the kidney and urine is created. So there are some slight changes with perfusion to the kidney and filtration and getting the urine out of the body. What that means is that older adults are a little bit more susceptible to having sensitivities to medications because their kidneys aren't working as effectively as they did when they were younger. There are other kinds of genitourinary changes that occur as a result of these normal changes, and I want to mention them specifically because we do commonly see urinary incontinence in both women and men, although more commonly in women up until about age 80. But urinary incontinence is not a typical change of aging, and one of the things I try to encourage older individuals is to let their healthcare provider know if they're experiencing urinary incontinence. It's not something you should put up with. It's not something you should expect. There are things that can be done, although it's often hidden. You know, there's a lot of products out there and pads and things, so it's often self-managed when there might be some things that can be done to decrease it. Another thing we see more commonly because of these urinary tract changes is an increase in urinary tract infections. And I have this iceberg here to remind me that urinary tract infections often have a very atypical presentation, or the symptoms are kind of atypical. So somebody may come into a healthcare provider with being very, very confused, no fever, nothing really clear in that regard, but the confusion is there. And so then there's concerns about delirium or dementia, and sometimes just simply checking the urine will show that it's a urinary tract infection that could be treated, and then things start clearing up. Another thing that happens in the genitourinary tract is erectile dysfunction in older men, and some of that is related to that slight increased cellular enlargement of the prostate, which then interferes with the blood flow. And then we see dyspareunia, or painful intercourse in women, because of the thinning of the mucosal linings in the vagina as a result of decreased estrogen. So those are sort of the genitourinary tract changes. But again, these are age-related, pretty commonly seen, but not necessarily normal, and can be often managed. The endocrine system is, you know, it involves hormones, our hormone glands. And in most glands, there is some atrophy or decline in the structure and size, some decreased secretion of hormones with age. but the aging changes seem to be more in the hormonal actions. And a key one that we see is in glucose, that we see a lot more problems with management of glucose in older adults, particularly those who have are obese or have a family history of diabetes, and so they may have a little bit of trouble managing glucose. Reproductive function for women, it ends with menopause. For men, they still are able to have children, but because of the erectile dysfunction that I mentioned, there are some changes that do need to be looked at and managed. And then I'll just mention that there's some changes in calcium metabolism, which can have an impact on bones. There are other kinds of hormone changes that are more subtle, but again, we don't see some of the kinds of conditions that you might hear about in older adults, such as hypothyroidism or hyperthyroidism, even though there are slight changes in the thyroid gland or the adrenal gland, which it responds to stress in our body and releases stress hormones. Questions at this point? I hope this is informative for you. When I teach my biology of aging class, the undergraduate students towards the last 3/4 of the class go out and interview older adults and ask them about 3 physical changes that they've experienced. And so one of the really enlightening things for the students as well as the older adults is they're then able to take a look at the change and talk about it and know biologically what's kind of going on. A lot of the changes that people talk about when they do those interviews has to do with graying hair, which relates to changes in the pigments of the hair, but it's also genetic. There are some changes in loss of body hair, and there is increased hair growth for men in the ears and the nostrils and the eyebrows, and for women in the chin and the lips. These relate to hormonal changes usually in the body. Hair for both men and women can get thinner. For men, it recedes. And some of you may actually know that that's the sort of male pattern baldness is generally passed from the mother to the men. And my son has almost forgiven me for passing that on to him. Nails, and particularly toenails, tend to get thicker. They're much more difficult to cut. And some of that relates to decreased blood flow down to the periphery. They grow more slowly. They may have a yellowish color. And so I really encourage folks to explore getting foot care. There are usually foot care specialists at any clinic that you can check in with. And then you can get the appropriate care for your feet, as well as not run the risk of cutting skin and bleeding all over. You can probably tell that happened to my mom, so that's why we're focusing on foot care these days. Other kinds of skin changes, so we call this the integumentary system. There is some reduced glandular activity so that our skin is drier, a little more scaly. There's decreased subcutaneous fat, so that cushion is decreased, and that means that we we can get cold a little bit more easily. Topical medications actually get absorbed a little bit more quickly, and so that's something you want to be careful about. Our skin is less elastic, so we see thinning and wrinkles and some sagging, but more of that with sun exposure. We also have some fragility of the skin because of that decreased fat cushion, and so some people experience skin tears when they are rubbing their skin on a bed or something like that. Some injuries and infections are more common, and then easy bruising can be seen as well. Some of that is more medication related or hormonal related, but we do see it with skin changes. And I do think it's important to point out that only about 15% of the skin aging that we see is intrinsic. In other words, that it's genetic or it's related to aging. The rest of it is extrinsic. And this is kind of a illustration of two sisters who grew up, twin sisters who grew up in separate parts of the country. And you can just see the difference of sun exposure for one versus the other. And that's why you hear so frequently about the need to protect yourself from the sun. It can really have an impact. Some other physical changes that have a big impact on older adults' lives is muscle and bone changes. There is a decrease in muscle mass. This is known as sarcopenia. And so it leads to decrease in strength and endurance that involves a lot of muscle activity. This happens regardless of what we do. It is a normal change of aging, but actually exercise, good nutrition can slow that progress down. So I encourage you to think about that. Tendons and joints stiffen with age. About 65% of people over 65 have stiff joints. But the stiffness that is involved in osteoarthritis is not a normal change of aging, even though we see it so much more commonly in older adults, particularly women. Bone density declines. It occurs in all older adults, although we see it more commonly in women because there is that once they go through menopause, we see more changes of osteoporosis and changes in bone density. But osteoporosis is not a normal change of aging. And in addition to being more at risk for falls and hip fractures, we see changes in height as a result of osteoporosis, as well as sometimes some degenerative disc disease related to osteoarthritis. And that's just illustrated in this picture to say, the height can really decrease as a person gets older.
Dr. Cochrane, we've got a couple of questions in the chat.
Okay.
First one is from a few slides ago. They ask, what about kidney stones?
Kidney stones are not necessarily increased with aging, but it can be related to issues with calcium metabolism, and they're certainly painful. But the best thing to do is to try to follow a good diet, keep your fluid intake up, and then see a healthcare provider if you're having that sort of pain. But we don't see kidney stones necessarily more frequently in older adults as much as people who have a propensity to it. It's not a normal change of aging.
Thank you. And the second question is, what about statin drugs and sarcopenia?
And what? Sarcopenia?
Yes.
Yeah, so statin drugs are very important for helping to keep our cholesterol levels low, but there is a side effect of statin drugs that can impact muscles, pain, and strain. Not everybody develops that as a result of taking statins, but it's something to be tuned into and let your healthcare provider know, because the type of statin or the dosage can be modified to address the issue.
Thank you, Dr. Cochrane.
So one of the things I want to mention is that function, as opposed to all of these biological changes, is a very important consideration as we age. And all of the sort of physical changes I've gone over so far can really impact one's function. We talk about activities of daily living, which are things like going to the bathroom, feeding ourselves, transferring from a chair to standing up, or from the bed to a chair, that sort of thing, as well as instrumental activities of daily living, which are a little bit more complex and involve things like grocery shopping, managing medications, calling people, and those kinds of functions are some of the key considerations that would indicate a person is probably going to need more personal care or more changes in their living environment, perhaps some environmental modifications like grab bars or things, or someone coming in to help, home care, grooming, bathing, whatever. And in fact, if we look at data from the community all the way to a skilled care facility, it's really those functional changes that sort of predict when a person needs to move to a more supportive living facility in order to address their needs. And so keeping tuned into your function is good because there are a lot of things that you can do when you start to notice changes that can hopefully get your function back. But considering new living arrangements is an important possibility if a person has functional needs that need to be addressed. So then let's talk, I've been talking about all these changes, been talking about age changes that we can't do anything about, and some age-related changes that happen more often in older adults, in part because we have a much longer lifespan of being exposed to things and following bad habits. But health promotion is more than just disease prevention. And the goal really is to focus on healthy aging. It's interesting because a lot of the scientists have focused on staying young. If you go back through the libraries and that sort of thing, there's a lot of research looking for sort of those magic bullets, those pills, those treatments that are going to help somebody stay young. But our goal is really healthy aging. And I just want to mention that you should take advantage if you are just about to launch into Medicare, take advantage of the Welcome to Medicare visit, as well as the annual wellness visits. Those are set up to really address health promotion, early signs of physical changes, things like nutrition, smoking cessation, that kind of thing. And it's important to note that the kinds of physical decline that we experience, those age-related changes that we experience, 70% of that could be modified just through changes in our health habits, not through finding that magic pill or that fountain of youth, but just the things like stopping smoking, improving nutrition, physical activity, weight control, preventing injuries from falls, and then using good preventive services to screen for illnesses, as well as take advantage of the resources that are available to keep us healthy, rather than being a couch potato. So smoking cessation, this chart is just sort of to show you that stopping smoking at any age reduces rates of emphysema, cancers, cardiovascular disease. You see that somebody who's never smoked has sort of this, the best lung function. It's a slower decline, whereas somebody who continues to smoke, they have decline in lung function that happens pretty rapidly. So I encourage you to take advantage of local cessation programs, medications that are now available, supports that are now available, and don't get too mad if you are a smoker and your healthcare provider asks you at each visit about your smoking, because there's a really strong mandate now to try and address that, because it has such a profound impact on all aspects of our health. Nutrition is another thing that can be affected by the changes of aging. So when we have sensory changes and foods don't taste as good, we might be putting too much salt in to get that flavor. Our oral and our gastrointestinal changes can impact our nutrition. And in fact, some people with the changes in their chewing and swallowing abilities have a problem known as dysphagia, which means they have difficulty swallowing and potentially can even have problems with aspiration. So, and muscles and bones being able to actually, with arthritis, hold utensils appropriately, increase body fat. These are all things that can be impacted by nutrition, or can set us down a different path, different nutritional path. Other changes that are not really the physical changes, but I just want to mention that can affect dietary intake, because dietary intake is so important for maintaining our health, are things like the social isolation and loneliness that we're seeing right now with folks who are separated from family and friends during the social distancing. Loss of a partner can have a profound change. The social aspects of eating, which are so important to us, are missing, and so we don't eat as well. Also, when we don't have the ability to go out and get healthy foods, or maybe we don't even have the funds, food insecurity can be a real concern. So some recommendations about nutrition are to focus on having a healthy plate, at least half of it being fruits and vegetables, protein, having some dairy, but not overdoing it. And I want to mention staying hydrated is really important. A lot of people focus on, oh, I've just read this article and I should be taking mega doses of this supplement or that supplement. The research pretty consistently says that if you get your nutrients through food, in other words, in a food matrix, you'll do better than trying to get it through supplements. It's not always possible to do that. And so just a multivitamin a day is probably a good thing, except in unusual situations. So physical activity is another one of those modifiable things. It gets you off of the couch. And I put this little diagram here to remind me that there is this sort of cycle of inactivity that can happen where we experience some symptom or some change of aging, so we decrease our activity, and then we experience some hazard, what's known as hazards of immobility. In other words, changes, our body starts breaking down, our muscles get weaker much more quickly without activity. And so then we are deconditioned, and it causes more symptoms, which causes us to slow down even more. And it's kind of this vicious cycle. So the benefits of physical activity are there regardless of other risk factors that you have. Even if you quit smoking, you'll still get benefit from getting more physically active as well. Some activity is better than no activity. So if you can't meet the prescription for physical activity that you're getting, any activity would be good. More activity has even more benefits. And those benefits occur whether or not you are losing body weight as a result of your physical activity. So just the physical activity is good. It gets blood circulating, it gets oxygen down, that kind of thing. And the recommendation is to be physically active at least 3 or more days each week, and ideally engage in these 4 kinds of activities. Flexibility that involves stretching, endurance, walking or cycling, strength, some weight training or lifting things, and then balance is very important, particularly as you think about for fall prevention, which I'll get into in a minute. So falls in older adults are common. They can be life-threatening, but they're also preventable. They're not a normal part of aging. The causes are usually multifactorial. We're taking medications that can affect our balance and our cognition. We are sometimes walking in neighborhoods that have a lot of uneven pavement that can increase our risk. With the changes in our eyes, we don't see shading as well, and so we might trip on steps or something like that. There is an increased risk of injury, in other words, fracturing, breaking bones, in people who have osteoporosis. But that kind of risk of injury can happen if it's a hard enough fall, even without the diagnosis of osteoporosis. So fall prevention is really important. Some things to think about is that older adults who've had previous falls or who stumble frequently are much more likely to fall again. And one of the things I often tell people is fear of falling is a significant risk factor. In fact, it's really the key risk factor. When we're afraid we're going to fall, and you know, we should be concerned, but we sometimes will restrict our activity, we won't exercise, we won't engage in balancing activities, and so that can make us more at risk for falling. It can cause us to not be as mobile and to have more functional dependency, so that we are not keeping our muscles and our joints active and moving. And then the anxiety sometimes that can come with the fear of falling is problematic. For example, if you are if you encounter some sort of a balance challenge, like uneven pavement or something, that anxiety can kind of come in, and if there's decreased reaction time to those kinds of hesitancies, then a person can be at risk for fall. So fall prevention is key. Having someone take a look at your medications to see if any of them have an impact on your balance or your cognition, taking a look at your environment, getting cords out of the way, keeping your home environment well lit, having grab bars where they're convenient. All of those kinds of things are important. And there actually are people who can go through your home environment and sort of check for all of those hazards of fall, but also, you know, taking a look at your neighborhood and what kinds of exposures there are. Another thing that's important for older adults is sleep. And so I wanted to include some healthy aging tips because getting adequate sleep is really, really important. You know, if you're not getting enough sleep and you have some of these other normal changes, not enough sleep can kind of tip that balance towards experiencing more of the age-related changes. So what can you do? Use your bed only for sleep or sex. If you can't sleep, get out of bed and read or something like that before trying to sleep again. Put your sleep quality as a high priority. Make sure your environment is at a good temperature. Usually a little bit cool is good, well ventilated, and that light is diminished. And this is something we're dealing with it more with children right now, but keep those devices away from the bedroom because the light from those devices and the alerts can really interfere with a person's sleep. Set up some bedtime rituals so that you go to bed and get up at the same time every day. Prepare for sleep for about 20 to 30 minutes of relaxation. And I say all of this because older adults do have a little bit more uneven sleep, a little bit more difficulty getting to sleep at times and maintaining sleep, and their sleep cycles change. So these are some practices that you can do to kind of ensure that you are taking care of yourself. Things to avoid are napping after 3 o'clock. Now, napping is okay for an older adult, and in fact, for some, particularly those who are already experiencing some cognitive impairment, sometimes a good nap after lunch or something can kind of brighten you back up again for the rest of the day. But napping too much after 3 o'clock then starts interfering with that nighttime sleep cycle, and then a difficult night of sleep. Going to sleep too early is something to avoid. And also avoid heavy eating, because remember, I just mentioned all of those changes in your gastrointestinal system and heartburn and that sort of thing. Heavy eating late in the day means that you're going to be your body is going to be trying to digest it and work it through while you're trying to sleep, which is problematic. Caffeine and alcohol late in the day should be avoided. Smoking and exercise, although daytime activity earlier will promote sleep. And then while you're trying to sleep, try to avoid thinking about all that's going on, doing problem solving or rehashing the events of the day. And setting up a ritual can help with avoiding those things pretty well. So what is healthy aging? These are just some examples of kind of extreme healthy aging and normal healthy aging that I thought you might be interested in. Sometimes we talk about successful aging, but the view has been that successful aging implies the absence of any issues. And I view healthy aging as living a good life and managing even in spite of chronic illnesses or physical changes. So some truths about aging are it's never too late to learn things. Most older adults function quite well and age with health, even with chronic illness. And it's never too late to start and benefit from those good lifestyle habits that get you off the couch. Pursue a goal of not just adding years to your life, but adding quality of life to those years. These are some great website resources. We're bombarded so much with information, and some of it's pretty suspect. The National Institute on Aging and the American Geriatric Society has reliable information if you have questions about things. And then I just wanted to mention this sort of swamp of, you might look at it as a swamp of aging, but think in a positive way that management of this changes of aging problems can be solved. We can take and ask for other people to assume some responsibility for creating good environments for older adults, and thinking about what's around us that shapes us, not just our environment, but our friends and our family who care about us and want to see us continue to stay healthy. And so finding opportunities in life's challenge can have all kinds of benefits. I'm from Alaska, so this picture resonates with me, that if we can keep ourselves pretty active and aging in a healthy way, then we can conquer all sorts of challenges. So, other questions?
Yes, Dr. Cochrane, we have a question. Is finding a geriatrician better than an internist or other physician?
I think finding a geriatrician is wonderful. The dilemma is there are not a lot of geriatricians in practice. We have quite a dearth of geriatricians. We do also have adult gerontological nurse practitioners who are skilled in addressing issues for older adults. But one of the things that a project that I'm involved in is that we are working very, very hard to enhance internist and family medicine providers' understanding and awareness and ability to manage the issues that older adults present, given that there are not the geriatricians out there, clamoring for patients right now.
I don't see any other questions coming through.
Well, I hope that's not because this was all clear as mud. Feel free to email me. My email address is here, barbc@uw.edu. Happy to connect with you, and hope to see all of you in person when we're on the B side of this pandemic.
Well, thank you so much, Dr. Cochrane. We really, really appreciate your time today and the information that you provided in this presentation. Are there any final questions anyone would like to ask? Remember, you can type them into the chat feature on your screen. And we'll give it a minute, see if any other questions come through.
I see a question that says, please repeat those websites that are helpful. So it's, you can just go into a search box or what they call Google it, National Institute on Aging and the American Geriatric Society.
And a question, how long should exercise be?
Usually the recommendation is 30 minutes, at least 3 days a week. But the idea is to exercise to a level at that point that you're actually working a bit hard. And the more, the better.
Of course. Well, if we have no further questions, then I think we're just about ready to wrap up. So again, we will email a copy of the slides to all of you along with the speaker's contact information. We'll also include a survey sheet that we would ask you to fill out so you can tell us about your experience on the Zoom event today. We'd love to hear from you. We're interested in hearing your comments to make this experience even better in the future. Oh, it looks like we did have one more question that came in. I felt that keeping my caregiver, who's a nurse practitioner, would be better because he would know about my history. So more of a comment.
Yep. It's definitely a good idea to have continuity in your caregiver. All right. Bye, everyone.
Thank you, Dr. Cochrane. On behalf of Elliot, myself, and everyone here at University House Wallingford, thank you for joining us. Enjoy the rest of your day and stay healthy. We might feel a little older, but wiser today. Thank you.